Hello, everyone, and welcome. Welcome to the webinar. I'm Dr. Brandon Fayetta. I'm one of the chiropractors here at Align Life of Sugar Hill. If you're joining us today, chances are you or maybe someone that you care about or know is dealing with neck pain, low back pain, or maybe both. Maybe it's been nagging you for months. Maybe it's stopping you from working out, or maybe you're just tired of feeling limited by something that should be fixed and should be simple to fix. Either way, I'm glad you're here. My goal is to help you understand three key things. One, the primary cause behind most neck and low back pain and why the usual rest and medication approach doesn't fix the problem for good. What we do at Align Life to actually help discs and nerves heal without surgery, without drugs, and without injections. So by the end, I want you to feel clearer, more confident, and more hopeful about what's possible for your body. So let's get into it. Like I said, guys, I'm excited that you guys are here. Let's talk about you for a moment. Maybe this sounds familiar. You're sitting all day for work, and when you finally stand up, your low back feels tight, stiff, or maybe painful. You're constantly rubbing your shoulders or your neck and rolling your shoulders trying to get comfortable. Driving hurts, sleeping hurts, bending down to grab laundry or clean the house hurts. You turn your whole upper body, not just your neck, when checking your blind spot in the car. Or your back flares up when you're vacuuming or picking up your kids or carrying groceries. Or maybe you're more active. Maybe you lift, run, train, or play sports. And now your back or neck is holding you back more than your muscles or stamina. I want to share a story with you that a lot of people relate to. One of my buddies back in chiropractic school was extremely active. He lifted 4 to 5 times, 4 to 5 days out of the week, stayed in great shape, and did everything right. One day he was working out and felt a little tightness in his low back. It wasn't painful, just tight. So, of course, like any of us, he finished his workout and went home, didn't think much about it, but the next morning he woke up and could barely move. His back completely locked up. I remember him calling from the other room, or calling me from inside my room, and it obviously sounded like he was in pain and he couldn't get up. And of course, me and my buddies were, first of all, making fun of him, but second of all, we knew this was a big deal. So he started leaning off to one side. Like I said, he couldn't stand up straight. And then, of course, driving was almost impossible. And once the pain started traveling down into his leg, sitting and sleeping became miserable. And he kept saying what so many people say: I didn't even do anything. I didn't even do anything crazy. So how did this happen? A lot of people have stories like this and stories like his. It starts with stiffness, tightness, or maybe a mild tweak, and suddenly your back goes out or your neck locks up and you have no idea why. If that's you, don't worry, there's a reason for it. Once you understand that reason, you can actually begin to fix it. I firmly believe that if people understood how their body works, they would make better decisions for it. You live your entire life through your nervous system. Your brain, spinal cord, and nerves are constantly communicating. So it's going from your brain, the communication is going from your brain to your spine, to the nerves, and out to the rest of the body. Then it comes back up, that communication from the body to the nerves, back to the spine, and back to the brain. Your spine has 2 big jobs: protect your nervous system and allow your body to move. Between each pair of spinal bones sits a disc, which acts like a spacer or a cushion. Whenever we have those disc spaces that are healthy, it gives a portal for the nerves to exit and travel through your body. A disc is like a jelly donut, if you will. So the jelly is the nucleus, which is the middle, and it sits right, like I said, right in the middle. The breading is the annulus, and it holds everything together. So over years of sitting, poor posture, lifting in sports, football, baseball, basketball, volleyball, accidents, motor vehicle accidents, or athletic injuries, and repetitive stress, the breading starts to tear. Then when it does, the jelly pushes outward, and that's a bulging disc or a herniated disc. You guys probably have heard of those before. So at first, you might feel general back pain or neck pain, or honestly, nothing at all. Because if it's not putting pressure on the nerve, people can live with those disc bulges. But as it progresses, the pain starts to travel. It can travel if it's down in the low back. It can travel into the butt or the thigh. It can go down into the leg, into the calf or foot, or from the neck into the shoulder blade and down the arm. Sometimes even into the hands, and you can get some numbness and tingling after that. So what that is, we call this peripheralization, meaning the pain is moving away from the spine. It's a big sign that a disc and nerve are involved. This is why so many people are told they have a shoulder injury or piriformis syndrome, sciatica, rotator cuff issues, but the real problem is actually their spine. So why traditional approaches don't fix the problem? Most people start here. Let's just rest for a bit. Maybe it'll go away. Here are some pain meds. Try muscle relaxers. How about have you considered injections? But the problem, none of these really fix the structure. Rest might calm things down temporarily, but the discs actually need movement to heal. Rest alone often slows the healing process down. Pain medication and muscle relaxers, these can help you make you feel better, but it's only temporary. But they don't move the disc away from the nerve. They don't improve alignment, and they don't fix, of course, poor posture or poor movement patterns. They just quiet the signal. You end up feeling better while the problem underneath continues to get worse. That's why so many people go months or years without meaningful change. So let's talk about the discs. So the two things discs need to heal, your discs need, like I said, essentially two things to consistently heal properly. So one is proper movement, and two is blood flow and a healthy healing environment. After puberty, discs no longer have a direct blood supply. They rely on movement and pressure changes to pump nutrients in and out and flush waste out. So no movement, no pumping equals no healing. Pain-free does not always equal healed. It can take up to a year to actually heal a disc bulge, even if at all. Avoiding movements reinforces dysfunction, and that's why our approach addresses both the structure and the environment the disc and nerve are healing in. So this is how we approach it here at Align Life. Here's what makes our care different and why we see results even with chronic cases. A non-surgical spinal decompression, that's one of our core pillars. When we determine you have a disc-related issue, decompression is one of the most effective tools we use. So for decompression, we gently pull the vertebra apart. It reduces pressure on the disc. It creates space for the nerve and encourages the disc material to move back towards the center, which helps the area rehydrate and heal. The key is precise, progressive traction, not the aggressive yanking or quick pull some people imagine, or maybe some people have seen on YouTube. We allow your body to relax into the process so your muscles don't guard or tighten up. Okay? This is where many people finally feel relief from the deep, stabbing, radiating pain that's been holding them back. So what else do we do? Functional movement plus home corrective tools. Yes, decompression is powerful, but if you move poorly during the other 23 hours of the day, you can undo that progress. When necessary, we use functional movement assessments to find what patterns are overloading your spine, where your mechanics are breaking down, which movements are feeding into your pain. Then we teach you specific corrective exercises and positions to support the decompression work. We also use what we call the Align Right kits, our home care tools that help stabilize the spine, improve alignment, reinforce healthy mechanics, and keep pressure off the irritated discs. This combination helps the work we do in the office stick and helps you protect your progress at home and for a longer period of time. So another thing that we do in the office, again, it just depends on your goals and our findings, is called shockwave therapy. We complement decompression with shockwave therapy because shockwave helps by stimulating blood flow into the area. It also breaks down scar tissue and adhesions, improving circulation and triggering the body's natural healing response. So this is accelerating recovery in chronic, stubborn, soft tissue. When someone has been in pain for a long time, the soft tissues around the spine become tight, guarded, and full of microadhesions. So shockwave helps reset that environment to so decompression can do its job even better. Okay, and one other thing that we do in the office is functional nutrition. functional nutrition support when it supports the goals of the patients. We don't give every patient a nutritional plan, but when your body is trying to heal discs, nerves, joints, connective tissue, the right nutrients can dramatically support that process. So we use functional nutrition to support tissue repair, promote a healthier inflammatory process, give your body the building blocks it needs to heal. And this is never the main show for most of our decompression patients, but it simply complements the decompression and movement work, okay? So if any of this kind of sounds like you or your life right now, waking up stiff every morning, avoiding certain activities, maybe with your kids, living around your pain instead of living in your life, feeling older than you are, feeling limited by something that you should be able to fix, it doesn't have to stay that way. But it does require taking action. You're the one who heals. Your body does the work. We're here to guide you, support you, and give you the tools and strategies that actually help the disc spaces and nerves heal. So when you schedule an appointment, here's what we do. First of all, we listen. You tell your story, what you've tried, what hasn't worked, and how this pain is affecting your life. Then we examine you. We run a targeted exam, we take x-rays, and if an MRI is appropriate, we coordinate that as well. And then, of course, we explain. We always want to educate. On your follow-up visit, we go through everything together. We show you what's happening in your spine and why you feel the way you do. And then we design a plan. If it makes sense, we build a personalized plan that may include things like what we talked about: decompression, functional movement strategies, chiropractic care, align right home tools, and possibly shockwave therapy. Sometimes even optional nutrition support, all based on what you need. Again, our goal is to simply help you heal so you can get your life back. If you're ready to take the next step, you could schedule a consultation using the link below. We'll walk you through everything together and help you figure out the right path forward. Thank you guys for watching, and I hope to see you soon.